Over 80 million Americans, they suffer from back pain. 80% of the population in the United States, they suffer from a severe back pain at least once in their lifetime. A lot of people come to our office with acute back pain and we help them. They say that it happened yesterday, they picked up a heavy object, or they simply slept wrong. A lot of people come to our office with chronic back and neck pain. They have had it for 10 years, 20 years, 30 years. They suffer from herniated disc, sciatica, facet syndrome, pinched nerves, degenerative joint disease, osteoarthritis, spondylolisthesis, spinal stenosis. We help them, and I'm about to tell you how we are helping these people. My name is Dr. Maz. I practice at MedWell Sports Medicine and Physical Therapy Center in Midland Park, New Jersey. We are a panel of doctors and physical therapists working together at one location. I'm also the author of this book, How to Live Pain-Free and Happy, Drug-Free, Non-Invasive, Non-Chemical, Non-Surgical Steps for Resolving Chronic Back Pain, Chronic Disc Problem. I wrote the book. I'm going to make a bold statement. Your back and neck pain is treatable, and it's not only a muscular problem. It is a neurological problem. This is an area that is commonly missed among doctors. And that is why you're still feeling the way you're feeling. That is why you still have the symptoms. What makes us unique in this office is that we diagnose you with on-site diagnostic studies to make you out of pain as quickly as possible, followed by neurological and other treatment. Then we start you with corrective care, so you will not need us anymore for the rest of your life. The reason you're watching this video is because either you or someone else that you know of is suffering from chronic neck or back pain. What if I tell you there may be a painless, non-invasive, non-surgical, and non-chemical solution that will fix your back problem? If your back and neck pain comes and goes, you better listen to what I have to say. If you take a list of medications or supplements and you still feel horrible, you better listen to this video. I do not want to be abrasive. Don't get me wrong. Most people like to be nice than effective. I want to change your life and I want to be effective. I'm very serious about fixing your spine. My goal is to add value to your life so you're able to do what you want to do with your children, with your spouse, with your family, and with your friends. I want you to ask this question from yourself. If I continue doing what I have been doing or what I'm currently doing, will I be better, same, or worse the next year or so? Most likely the answer is that you're going to be worse. If your current treatment would be for fixing your body, you would have been fixed by now. So let's define spinal problems. Spinal problems affect millions of Americans. Your spine starts from your skull all the way to your coccyx, the back of your butt. Most people suffer from either general back or neck pain, muscular problems, pinched nerves that causes numbness and tingling to your arms or to your legs, degenerative disc disease, so where that you're supposed to have two nice bones with a big thick cushion in the middle. The disc has shrunk. The disc has shrunk in height. So instead of looking like this, it looks like this. The disc has shrunk. You may get degenerative joint disease, facet syndrome. You may have inflammation in these joints over here. Sciatica, pain going down to the back of your leg, spinal stenosis. The treatment protocol that you will hear has helped hundreds of patients successfully during the past decade.
After the first visit, I'm feeling so much better that it's amazing to me that I'm feeling this much better after one visit. As he says, I'm smiling, and I see I'm walking better. My shoulder, my neck doesn't hurt the way, because I had constant pain on my neck and shoulder here, my ear, around my ear, and I don't feel that I have more mobility in my neck. I'm walking better. I get up and I see I'm walking without fear of being unbalanced, and I'm just feeling more energetic. Everything in one treatment. It's like I can't believe that I have this much improvement in one treatment.
I have studied over 10 years of latest research in diagnosis and treatment of these series of conditions. I'm also trained by the country's leading expert, Dr. Michael Johnson. Until recently, you had three main choices to treat your spine. One was living with the pain, which would usually get worse. Then taking medication, which just covers the symptoms and masks your symptoms, or undergo dangerous surgery, which could cause failed back surgery syndrome, or make you unable to do the tasks that you want to do even if the surgery is successful. You wouldn't be able to pick up your children. You wouldn't be able to play. You wouldn't be able to do a lot of the things that you like to do. I've had patients who have had 3, 4, 5 surgeries. It's awful.
After I came to MedWell, after one visit, honestly, I felt so much better in the evening. I can't tell you, and I'm here the next morning to try going to MedWell and getting better.
I want you to understand, in your back, I try to make it as simple as possible. In your back, there are mainly few components that things could go wrong. One is bone, nerve, joint, muscle, and disc. Okay? So there is bone, joint, muscle, nerve, and disc. There are other choice of treatments which address some of these, but not all, and that's what the problem is. For example, physical therapy. Physical therapy is good, but massage only helps the muscle. Adjustments, the chiropractors do that. That is good, but it only increases joint mobility and proper joint alignment. Usually in your back, due to gravity, as we are standing all day long, gravity and years of pounding, the structures in your back start compressing. The disc space shrinks, the nerve gets pinched, everything goes downward. So you lose disc space, you get pinched nerve, you get facet syndrome, you get sciatica. You're about to hear a groundbreaking, transformational treatment that has helped hundreds of patients successfully and has changed people's lives. What makes us be able to get the results that we get and makes us unique is by having DTS spinal decompression system. That's the first treatment that we're going to discuss. Then we're going to go ahead and discuss neurological brain-based therapy. You do not want to leave any stones unturned. We need to address the bone, nerve, muscle, joint, and disc. Our goal is to investigate the true cause of your problem. We define what is the true cause of the problem, design a diagnostic and treatment plan that addresses the cause, and deliver the treatment on site under the supervision of our doctors, under the supervision of our physical therapist, that is painless, non-invasive, non-surgical, and non-chemical.
I've only been coming from MedWell about 2 weeks, and I was literally crippled when I came in and couldn't sleep at night. And I have to say that at this time I could sleep all night, through the night, without pain meds. I don't use the cane. I just can't believe the difference between my condition when I came in and today.
We are going to go over DTS spinal decompression system. DTS spinal decompression system is a computerized passive distraction table that with no effort on your part, it stretches your spine. The key is with no effort on your part, so you can totally relax. Your brain is not guarding the muscles to relax. It is safe, painless, non-invasive, drug-free. Patients after proper diagnosis are prescribed series of sessions on spinal decompression system based on the doctor's clinical findings and evaluation. The decompression table, what it does, it's designed to stretch or decompress. Remember I said everything gets compressed? So it decompresses the structures in your lower back and your neck. So it enables you to get the pressure off the nerve and increase the disc height that is missing. And sometimes you feel better after even one visit. A lot of patients, when they get off the table, they feel they're taller because everything is decompressed. A lot of times you fall asleep on the machine. It works great. There are similar systems in the market. They're called Spinal Aid, DRX. They are not the same as DTS spinal decompression system. Those machines, they try to mimic what DTS spinal decompression system does. They are not just the same. That's what we have experience with. That's what it works great. Many times, this treatment alone, it does it for the patient. Just this, without anything else. Another component of the treatment that I explained to you that's extremely important and crucial to be done in conjunction with spinal decompression system is brain-based therapy. What is it and what does it do for you? I will explain to you. Basically, on the back of the brain, there is an area called cerebellum. Cerebellum is in charge of your postural muscles from your neck all the way down to your coccyx, the back of your butt. Your cerebellum is the most oxygen dependent part of your entire body, not just your brain, your whole entire body. If it doesn't have enough oxygen, it will not work properly. If it has enough oxygen, it works properly. So, since your cerebellum is in charge of your postural spinal muscles, and if it doesn't have enough oxygen, it causes the muscles to go to spasm. When the muscles go to spasm, the bones lock. When the bones lock, the disc herniates and gets bigger, which causes back pain or neck pain. Sometimes the bone goes forward, called spondylolisthesis. Sometimes the bone goes backward, called retrolisthesis. That's why we need to do a thorough clinical exam. You should have a good disc space. If the disc space shrinks, the nerve gets pinched. Nerve goes to a muscle, causes the muscle to go to spasm. Muscle goes to spasm, remain untreated, you get atrophy. When you have atrophy, I can't help you. Most of the time. It depends what stage of atrophy it is. The disc degenerates, and the pain as a result goes down to the leg or down to the arms. So it's crucial to do the proper clinical evaluation and the proper treatment given at the right time.
I visited Dr. Maz because I had some back problems, and he was just so thorough. When he looked at what was going on in my body, he did a very, very good examination and did a lot of things that other chiropractors have not done, and really came up with a good answer and a treatment plan for me that has really helped me. I mean, I am able to sleep better. I don't have the pain anymore. He is just an amazing doctor. So thank you, Dr. Moz.
If your cerebellum doesn't have enough oxygen to work at its 100%, no matter how many treatments you take, no matter what type of treatments you take, no matter how many pills you take, the problem will not get fixed. And that could be the reason you still have the problem. We need to treat the spinal problem locally and give oxygen to your cerebellum. If we only treat the back, you may feel better, but the problem comes back. That is why we have to do local treatment and brain-based therapy, so the pain does not come back. That is what our goal is. So how do we test to see how well your cerebellum functions, and how do we do our neurological exam? We are trained with functional neurology to assess your brain function. There are certain maneuvers that we do. You may stand still with your eyes open and eyes closed. We check for a sway. And what direction is the sway? To see if it's a right brain problem or a left brain problem. You have always heard the right brain controls the left side of the body, the left brain controls the right side of the body. We do brain screenings with different neurological maneuvers. We check your eye movement. We check your pupillary responses. We may do nerve conduction velocity study to see which specific nerve is involved in causing the problem. The problem may be a vascular problem. Has anybody told you that? That is why we do vascular testing in some cases to see if the problem is a vascular problem. We may do a balance assessment to check your balance with a computer on a platform with your eyes open and eyes closed to see, based on your age and your height and your weight, how well is your balance comparing to the people with the same age, same height, and same weight. Are you ready to open the combination of your life? You guys are all here because you choose to be here to get rid of your symptoms, pain. By doing what I'm going to go ahead and tell you to do, I'm going to enable you to get your life back. So you don't have to suffer with pain, numbness, neuropathy, tingling. You won't be able to experience chronic fatigue, tiredness. That's why we're all here. We're going to define, design, and develop a treatment plan that's going to be effective and enable to get your life back. So one more time, you can get up in the morning and you had a restful sleep and you haven't lost your mind. This is the important part. I want you to listen carefully. I know your cerebellum, which is the back part of your brain, needs more oxygen. Why? It's because your brain needs two things to survive: fuel and activation. Proper amount of energy, proper amount of signals. Now, the fuel part comes from two sources: glucose and oxygen. Glucose is handled metabolically from what you eat. But oxygen is extremely important because brain does not store oxygen. Your muscles do. When cerebellum has enough oxygen, it works great. If there is not enough oxygen, it will not work properly. If cerebellum doesn't have enough oxygen, it's called oxidative phosphorylation. So if cerebellum doesn't have enough oxygen, it causes not to work properly, and how it doesn't work properly is by making your spinal muscles go to spasm, because it's in charge of your spinal muscles not to go to spasm. As a result, your bones lock. As a result, the disc may herniate and causes a pinched nerve. How do I know your brain needs more oxygen? It's because as you age, your ability to utilize oxygen diminishes about 1% after the age of 25. So that means if you're 50 years old now, your ability to utilize oxygen has diminished about 25% already, and next year is going to be 26%. So we are all oxygen deprived. That is not considering if you're a tobacco user. That's not considering if you consume alcohol. That makes it even worse. We have patients when we give them oxygen treatment in this office, we have patients who come in with severe pain, chronic depression and insomnia on top of that. They can't sleep well. They haven't slept well for years. Only after a couple of visits, they are surprised. They come with their spouse. They are surprised how much they feel better and happier they are. They feel that they can even sleep better after just a couple of visits. That happens all the time, and I have testimonials to prove it.
I came here because I was having severe back problems. I was actually moving a planter and I felt an electric current running up my spine. And this is my second visit here and I feel so renewed, so alive. They gave me oxygen treatment. They put me on various apparatuses. And I just feel like I've used other chiropractors before, but never before have I felt this way. And I will definitely be coming back, and I want to thank MedWell for everything. They have superior people here. They are just down-to-earth, helpful people, and I really had a great experience with MedWell.
So, the solution is to give enough oxygen to your cerebellum. How do we do that? That is our first step of brain-based therapy that we do in this office. We give you supervised oxygen treatment on-site prescribed by our doctors. We have over 15 oxygen therapy stations in this office. This oxygen treatment, what it does, neurologically, it facilitates a loop in your brain that has to work properly. It's called neocortical cortico-thalamo-hypothalamo-pontomedullary reticular activating system. So if this loop works properly, your cerebellum will work properly. It took me about 3 years to be able to say that. I tell you up front, I'm not a professional speaker, but I'm a doctor that you could depend on.
I've been here for only 5 visits. And it's the first time I can say in years that I am pain-free.
We may give you exercise with oxygen treatment. We have had a tremendous success with that. So you do exercises while you're getting oxygen treatment. What other brain-based treatment we give you? The treatment that works. The treatment that is painless, non-invasive, non-surgical, and non-chemical. We may give you interactive metronome. Most of our patients, they get some type of a therapy similar to interactive metronome. Interactive metronome is a computerized device that produces auditory stimulation. What it does, for example, it produces like a cowbell sound at certain time slots every 5 seconds, and every 5 seconds what you need to do, you need to clap your hand or bring one foot in front of the other. And what it does, it measures your response time to this auditory stimulation. So what it does, it helps you to respond to auditory stimulation faster. That is why our patients who go on that machine, it prevents them from falling. That is why it helps attention deficit disorder, attention deficit hyperactivity disorder. Most of our patients who are mainly children population or adult population, they go on this machine because it helped them tremendously without the use of shots, pills, drugs, or surgery. You may actually play in our office. Yes, you may actually play. What we do, and what I mean by that is, we make you exercise with visual stimulation. Our therapists, which by the way they are fantastic, have developed specific programs that will therapeutically help you based on your specific needs to enhance your rhythmic patterns and time limitations which mimic daily tasks. So what happens? You may play a video game like children's play. Okay? You may play a video game like a ski. There's a skiing game that you have to go at certain time, maneuver yourself to go between the barricades and go where the arrows telling you where to go. You may play a balance game. We have a platform, that's a flat platform, you go on it and the balance platform, it challenges you to stay balanced. So you bet it's going to help you when you get up in the middle of the night to go to the bathroom, it's going to help you not to fall. We have everything covered over here. It's a lot of fun games that you could play based on your specific needs and the therapeutic result that we want to get. This treatment has been incredibly successful with our children and adult population of patients. You may receive balance and movement training. You may get whole body vibration that stimulates bone formation. It prevents osteoporosis and it increases mobility. The balance, the vibration training that we have rather, what it does, it laterally moves as opposed to front and back. If you notice, all day long we go front or back. We go in flexion or extension. So what this machine does, it makes your body and your whole spine laterally move. So it makes your body much more mobile. A lot of times when people get off that machine, they say, wow, I can move faster, I can walk faster. We may give you TENS unit to take home for pain relief. Most of our patients, if they need it, they get foot orthotics. In this office, we have a special computerized scanner that makes 100% custom-made foot orthotics for you and only your feet. So it takes away the margin of error. If your foot has proper biomechanics, as you gait, as you walk, that will lessen the chance of having knee pain, hip pain, or low back pain. And that's why a lot of our patients who have improper foot biomechanics, they get this 100% custom-made foot orthotics. Most definitely, you get rehabilitative exercises. Many times, our patients, by the time they got here, they have been to chiropractors, they have been to physical therapists, they have had all the exercises, but nobody monitors them. There are some exercises that are bad for you to do. Exercise doesn't mean necessarily is good. You may do upper body ergometer. Upper body ergometer is rehabilitative exercises that you move your arms even if you have low back pain. Yes, for low back pain, because in the arms there's much more firing to the cerebellum than the legs. And if you want to make your cerebellum to fire more, to function better, we want to do upper body ergometer. Upper body ergometer stimulates the cuneo-cerebellar tract versus using the legs, which is spinocerebellar tract. Activities of daily living assessment and training. We do activities of daily living assessment and ergonomic training based on what you need. So you see, I don't treat the problem so the problem will occur year after year. Our goal is to fix the problem so the problem doesn't come back. Sometimes our patients, they bring in supplements. I want you to understand, I have never seen any supplement that cures a problem. They may help, but they don't cure. Back pain, listen carefully. Back pain needs brain-based therapy and neurological treatment. It will not get fixed. Yes, B-complex is good, fish oil is good for your brain, but they will not cure you.
Dr. Maz is one of the most caring, compassionate people that I've ever met. Not only is he one of the top of his profession and able to truly help people, but he really cares. If you need help, go see Dr. Maz. You'll be glad you did.
Ask yourself this: how has your condition affected you, your family, your job, your relationship? How has your condition affected you not to be able to do what you want to do? Not to be able to pick up your children, not to be able to go grocery shopping, not to be able to walk a lot, not to be able to sit behind a computer, not to be able to have a better sleep. Where do you picture yourself in a year from now if you don't do anything about it? In 3 years from now? In 5 years from now, where do you see yourself? If you're serious to correct it, you need to correct it, contact our office. If you don't care about your health, do not contact our office. I don't need to do this anymore. I do this because my passion is to help people to live better, and I have been fortunate that I could do that, that I could facilitate that. You can get treatment or not get treatment. It's not going to make a difference in my life. Your health is not my responsibility. Your health is not your doctor's responsibility. Your health is not your government's responsibility. It's not your spouse's responsibility. It's not your insurance company's responsibility. It is your responsibility. If you're serious about correcting your condition, our office is for you. Contact 201-848-8000.
Dr. Maz, actually, I ran into him at an event, and he offered to do something for me that I've had done many times before. He laid his hands upon, very gently, my neck, and he didn't do anything. He read it. He was able to sense what was wrong. Well, all I can tell you is you could hear noises across the room. They were very subtle. What he did was very subtle, but the changes were significant. How do I know that? Well, I don't sleep a lot. I have a real problem sleeping. And I went from 3 hours on average to 7 last night, and I can't explain how. That doesn't happen to me. I also felt more relaxed when I woke up. I usually have a tension in my hips, the joints. It's as if the hips are locking on occasion. I'm almost 50. I know I'm not very old, but let's face it, maybe it's irregular exercise. It happens. Well, whatever Dr. Maz did aligned some things in my life and changed some things. And we're not talking about drugs or invasive procedures or pain. There was no pain at all. I instantly felt better. I had what we call, I think he calls it range of motion. I suddenly was able to move my neck here when I was here. And I was able to move, I'm able to do things that I just wasn't able to do before. This man is more than just a doctor of chiropractics. This man is more than a healer. This man is a man with heart and dignity and character. If you have an opportunity to meet Dr. Maz, he is a doctor that other healers go to. I didn't know that. He's trained some of the best of the best. He truly cares. He's published, he has integrity, and he helps people eliminate pain and prevent long-term, very disabling scenarios. This is Joel Bauer. I believe in Dr. Maz.
If you want to take medication for the rest of your life, our office is not for you. You're going to be wasting your time and energy and our time. Sometimes people who are skeptical from care, they say, Dr. Maz, can I go to my own doctor and discuss this care program with them? And my response to them is, if your doctor knew about what I'm telling you, you would have been better by now without taking any more pills. Your doctor is treating your symptoms and not fixing you. We need to fix you. There are only a handful of selected doctors in the whole United States who are trained and certified to do the brain-based therapy and do the examination that we do. And I doubt your doctor is one of them. If he or she is, please go see him. All I'm asking you is go to a doctor who understands what I'm telling you. Orthopedists and neurosurgeons, I have a lot of respect for them. They are great doctors. They help hundreds of patients every day. But they help them in what they're good at, which is giving medication or some type of a pain management or surgery. My job, the doctors in this facility, MedWell Sports Medicine and Physical Therapy Center, our job is to make sure you don't take medication as long as you don't need it to prevent you having surgery. Can we guarantee it? No, we cannot guarantee anything in the health field. Are we successful? Yes, very successful. I'm asking you permission to help you. If you're serious about getting your symptoms handled, our office is for you. Call 201-848-8000. I just want to tell you now, not everybody is accepted for care. We only accept patients who we feel that we can truly help. So if what we have said to you has made sense to you, then you need to call our office and make an appointment with one of our new patient coordinators. When you come to our office, you're going to get a clinical exam, you're going to get diagnostic studies, and you may get treatment the same visit or the following visit. It depends how busy we are. Unless you're coming from out of the state, then as a courtesy, we try to give you treatment on the same visit. Once again, the treatment is painless, non-invasive, non-surgical, and non-chemical. I will look forward to seeing you in the future. You can call us at 201-848-8000. I want to thank you for watching this video and spend the time to learn about your health. Yes, we accept most insurance plans, and God bless you and your whole family.